onto the coronavirus front. With the rise of COVID-19 cases across the nation and here in Alabama, the number of hospitalized children infected with the virus has risen to levels never seen before. WDHN's Alex Valdez has that story.
They have this raspy, barky cough that we were not seeing with the other variants as much. We're seeing something called bronchiolitis, which is a respiratory illness that causes some kids to kind of have some wheezy symptoms.
Data from the Centers for Disease Control and Prevention shows that increase was seen in children who were 4 and younger, a vulnerable age group that is not yet eligible for the COVID-19 vaccination.
We are seeing a lot more kids coming in and being exposed to COVID as well, too. So we're having to test those kids as well. So it's a lot more just exposures and big kids coming in with positive cases.
Nationwide, more than 4 in 100,000 children 4 and younger were admitted to hospitals with COVID, double the rate than last month alone and 3 times the rate at this time last year. As of today, there are 50 children with COVID-19 in Alabama hospitals, with 8 kids in the ICU and 2 on ventilators.
You do not need to rush a child to the emergency room for a fever. That's a normal sign of the immune system doing its job and trying to fight something off. Having trouble getting a breath in or out through their mouth. I'm not talking about nasal congestion alone. Those are very good reasons to go to the emergency room.
Medical experts say it's critical to surround kids in this age group with people who are vaccinated to provide them the most protection. And for parents who are waiting for more data and hesitant to get their child vaccinated, medical experts stressing now is the time.
We have that data now. This vaccine is safe and effective. You can still get COVID even if you're vaccinated, but you're dramatically reducing your risk of any sort of bad outcome.
In Dothan, Alex Valdez, WDHN News for the Wiregrass.